You mentioned that you're due in about 4 to 5 weeks and you're anticipating labor and delivery. Of course, it's on every woman's mind when they start to get closer to their due date. You're wondering what sort of equipment is available at the hospital to help you with an unmedicated delivery. Each Intermountain hospital has a ton of different options for women who are going unmedicated, but you did mention something about your history that stuck out to me. You mentioned that you're attempting a VBAC, or vaginal birth after a C-section with this labor. And I suggest first talking with your doctor about your plan, because in most cases a doctor will encourage a woman to get an epidural if they're attempting a VBAC. And the reason for this is that your chances for a C-section are much higher, and the chance for an emergency situation is higher because you're attempting a VBAC. And for this reason, it's safer to have an epidural in place. The risk of uterine rupture exists because last time you had your baby, they made an incision on the uterus to deliver the baby and then stitched it up. And chances are it's healed nicely since then, but when you start to contract again and go into labor the second time, there's a chance that it could rupture or pop open. Similar to if I were to make an incision down my bicep and then I started lifting heavy weight, it could burst open. And because of this risk, most doctors, again, like I mentioned, recommend that a woman has an epidural, because in an emergent situation, if we had to do a C-section, we want an epidural on board. That allows us to just hurry and push the medication through a tube and get you numb and ready for a C-section in a matter of minutes. And minutes count in those situations. The alternative, if you don't have an epidural, is general anesthesia if you needed a C-section. And this involves taking you to the operating room and putting you to sleep. It's the kind of anesthesia you get if you had your appendix out or your gallbladder or something. They take you into the operating room and tell you to count backwards from 10 and you don't remember anything after 8. But because this is putting you totally to sleep, we actually have to help you with breathing because your breathing stops. And the medication that stops your breathing is also going through the placenta and getting to the baby. And this, of course, is a risk to them because we want them to come out screaming and alive. We don't want them to be asleep as well. And sometimes we have to do full resuscitations on babies who are born to mothers who have general anesthesia. For this reason, it's usually just reserved for emergencies only, and again, a reason why we encourage women who are attempting VBACs to have an epidural in place. Now, you might have the option of just having it placed and not dosed. So talk with your doctor again about your desires, and if it's just placed and not dosed, then you might still have the option to do different things in the delivery room, like walk and try different positions. And again, when you show up to the hospital, let the staff know about your conversation with your doctor, and if they said it's okay for you to try an unmedicated delivery with an epidural in place, then they will be more than happy to offer you all the options that are available to you and to support you through the process. Good luck with everything. I hope the very best for you and that you're able to have a vaginal birth this time. And do know that your chances of succeeding are great. 60 to 80% of women who attempt a VBAC are actually successful, meaning they have a vaginal delivery after a C-section. Again, I hope the best for you and congratulations ahead of time. And if you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.